Today I'm going to talk about TelePT for osteoarthritis. If you have osteoarthritis, or OA, you probably have enough pain sometimes that you don't want to move at all. One thing every patient with OA should remember is that the best solution for OA is movement. Movement improves blood flow, increases mobility, and strengthens your muscles. Unfortunately, many patients with OA instinctively decrease their activity in response to pain. That typically makes things worse. Patients with OA often present with very distinct signs. By definition, an arthritic joint will be inflamed. For example, a patient with arthritis in the knee will have a bulbous or larger than normal knee. There will be decreased movement at the affected joint. That same knee might not strengthen all the way and probably won't bend much beyond 90 degrees. Lastly, the muscles that control the movement of that joint will often be weak. Quadriceps, hamstrings, and calf muscles are the primary suspects with knee OA. Hip and core muscles are also usually weaker than normal. As a result, people with OA experience pain in the affected joint and have a difficult time performing normal daily activities. That might sound familiar to you. You say you need help with inflammation, range of motion, and strength? Then a PT is the right person for the job. We are the experts at decreasing inflammation, increasing range of motion, and strengthening muscles, especially with patients who have OA. Patients with osteoarthritis are ideal candidates for telehealth physical therapy as well. Treatment does not typically require extensive manual therapy, and the most effective interventions for arthritis involve movement and exercise that can be performed at home. After a thorough telehealth PT evaluation, a typical program involves the following. Education on reducing inflammation from osteoarthritis. So heat and cold modalities are one. Ice and heat are both very effective short-term solutions, and they feel great on an arthritic joint. Self-guided manual techniques. They're much easier than you might think. And movement. So safe, progressive activities to increase blood flow and lubricate stiff joints. Then we help you restore movement with general soft tissue techniques. We have lots of ideas and tricks for you to get to those elusive knots and tight spots. Stretching. Elongating shortened muscles relieves pressure on stiff joints. And active range of motion exercises, which reinforce mobility. Then strengthening the muscles that move and support your arthritic joints using non-weight bearing exercises for strengthening with minimal force on your joints, weight bearing exercises to activate multiple muscle groups for greater overall strength, and then functional activities like squats and stairs to safely simulate real life challenges. We treat a large number of patients with arthritis. We realize that our role as PTs and tele-PTs is not to cure OA. That's not likely to happen. Our objective is to assist our patients who have OA by reducing pain and restoring function. Our telehealth PTs get the opportunity to work very closely with you to achieve your objectives. After several sessions, when you've achieved your goals, the next phase of OA management begins. Now you simply need to continue doing the exercises prescribed by your PT. If you have OA, remember, the best thing you can do is move. TelePT can help you do that and get you back on track to a normal, pain-free life.